Hey guys, it's Jessica here at Pinski Dermatology and Cosmetic Surgery. We are about to start an Aerolase treatment for photo rejuvenation, and we're gonna have Kayla, our esthetician, do the treatment. She does the Aerolase a lot, and we're about to show you what a treatment looks like.
Hi everyone. Hi everyone, thank you for joining us today for our Facebook Live. Again, like Jessica said, we're going to be doing the Aerolase laser. This laser is a YAG microsecond laser, so we're going to be treating for some tightening and some photo rejuvenation today. The nice thing with the Aerolase laser is that the patient's going to go home, have no downtime. The energy actually is able to bypass the top epidermal surface and go into the dermis to kind of deep heat, tighten the tissue. So she's going to get a really nice improvement over the next few weeks. So we're going to now start treating the patient. You will see some pulses that we're going to be doing, and we're going to do a split face today just so it goes a little faster so y'all don't get too bored watching this. But again, we're going to be treating split face here, left side, and then we'll kind of at the end spot treat some of her pigment spots of concern, some little vessels she's got around the nose area, and she's going to get some nice tightening. We'll also work a little bit more. She's concerned with the jawline here. This treatment's great complement also to some other therapies. Pam has had the Silhouette Insta-Lift. She's working on some tightening. She's done Ulthera in the past. So this is going to kind of complement some of the things she's done. So I'm just going to get kind of ready for just a second here and we will get going. Okay, so this treatment is very painless to the patient, which is awesome because she's going to feel a little bit of heat, but it's actually pretty comfortable, which is nice. All right, we're going to turn on our laser here. So we're going to start with the 6mm lens. There's some different lenses. I'll kind of show you guys really quick. These different lenses that we have more focused energy. So we're actually able to kind of work on, since she's going to do some tightening, we're going to do, to show you guys a little quicker, one pass with the 6mm lens, then we're going to use this to further tighten the tissue. And then the 2mm lens is actually what we're going to use to spot treat some of the different things that we want to work on. Okay, so I'm able to adjust the energy of my laser here. So we're going to start off just a little bit lighter just so Pam can kind of get a feel for it. She's done lasers in the past, so she's pretty familiar with the sensation. She'll just feel some mild heating, and I'll just have you turn just a little bit more, Pam. I'm just going to lift the table just a little bit. Good. All right, so we'll start here. This is great also for under eye rejuvenation. We're going to take her up a little bit higher here. This is also really good for the pores. We're going to get her nose nice and good. For some of the little blackheads, it can actually help refine the pores and texture. So we're just going to do half of her forehead here. There you go, Pam, just between your brows here. Okay, so we're going to switch the lens. But turn it off for a second, it's so loud in the machine. How do you feel, Pam? How does the laser feel to you?
It is not painful at all. It's very tolerable.
Just a little bit of mild heat sensation as we go.
Exactly.
Yeah, that's how most patients will describe it. I know I look like I'm from the Jetsons, but yeah, most patients will say it's very comfortable, just a little mild heating sensation. At the end, sometimes when you pulse on the vessels, some of the pigment spots is a little bit hotter, but very comfortable, tolerable treatment. So we're actually going to switch the lens right now, and we're just going to, because this is a little lengthier procedure, we're going to kind of treat where I'm going to spot treat so you guys can see a little bit of it. So I'm going to kind of treat her through here and then some of the vessels which we'll pulse on and some of the little pigment spots that bother her. So we'll do this. This next lens, like I was saying, this is going to deeper heat the tissue here, so she'll get some nice tightening benefit with it, because that's what she's looking to treat today. This laser has a lot of indications. It treats all skin types, all skin colors, which is great. So again, you know, based on some of the concerns, we mainly treat acne here with it. We do photo rejuvenation, tightening, sometimes laser hair removal on our darker skin type patients, and overall just, you know, can help with firming the skin, good for texture, pores. So it's really nice to kind of add into a lot of different treatment therapies.
How many treatments do patients need?
Patients will typically do, so the acne protocol, we typically have them coming in very frequently, 1 to 2 weeks apart, and typically acne patients are doing anywhere from 3 to 6 treatments. And then photo rejuvenation, we're having them come back like every 4 weeks. Same with if we're working on laser hair removal, typically spaced a month apart. But yeah, it's you know, so consecutive treatments. That's definitely, I tell patients, the best bang for your buck is to do it the way the protocol is, because you'll get the best improvement from that. So now we'll kind of treat her just in a little smaller area here so you guys can see this. So again, here's our next lens that we're going to go to. We'll start off just a little lower so she can adjust to the energy. So you'll feel a little hotter pulses here, Pam.
Okay.
How's that, Pam? Feel similar, a little warmer?
A little warmer, but
A little
still very tolerable.
Perfect. So now this last part, just so we can show you guys, because we don't want to get, too boring here. We're trying to just let you guys see a few different steps of the Aerolase. We're going to do the spot treatment now. And the pigment spots for patients can sometimes look a little bit darkened after the treatment. This will lighten up. Again, it's not going to be anything that she's going to have any significant downtime. The spot might just look a little bit darker. But most times the vessels will have immediate improvement. So we're just going to put this lens on. This will feel a little bit hotter, especially over the vessels, Pam.
So I'm just going to answer a question with my glasses on. We got a couple questions about downtime. There really is no downtime with this treatment. You'll be a little bit pink afterwards. Every patient's skin is different, but pretty much you can walk out of here and no one can really tell you did anything. You are able to apply makeup. That is fine. After any laser or skincare treatment, we typically say don't exercise for 24 hours just because you don't want to heat up the skin and make it hot after we've already put some heat into it with the laser. But other than that, there's really no downtime, so you don't have to plan ahead or take off work or anything for this. The next day you probably won't be able to tell you had anything done. And I learned how to flip the camera around. Here's Kayla.
Perfect. Yeah, but patients leave. You can see her skin right now. I mean, she really just has a little bit of some mild flushing, but really nothing that she'd have any social downtime with. So she can go, back to work right away. This is easy to do. A lot of patients will come in lunchtime, get this treatment, and immediately resume normal activities. So now we're just going to do a little bit of spot treat. And you can see this little spot. We're going to do a few pulses right here. A little hot here, Pam. There you go. You can see that it's going to start to darken a little bit. We'll give her a few seconds in between. Good. That's a pretty light one, so that's good there. And then we're going to put your, hold down again, Pam. Here we go. We're going to treat some of these little vessels here. Treatment does have more passes than what we did. We just kind of sped it up a little bit, but you can kind of see she looks completely normal. Not too bad, Pam?
No, not at all.
Yep, and you can see more improvement right away in some of her vessels that we saw earlier. And then the pigment spot will kind of darken a little bit, and then that'll just start to lighten. Most patients don't get any scabbing, but if the lesion is a lot darker, sometimes you might get a little bit with that. But yeah, again, this was the YAG microsecond laser, and patients will come in, do a consultation with the doctor. It's a very easy procedure, and it can treat a lot of different things, all skin types, all skin colors. And then like Jessica was saying, you can immediately kind of resume normal activities, and then makeup can be applied the following day. Thank you for joining us, guys.
All right, guys, thanks for watching. So that was the Aerolase treatment. The last question we got was, what is the best thing about this laser? And I think Kayla kind of just touched on it, the fact that it has so many different options for different conditions it can treat, for acne, redness, pigmentation, tightening, everything. So it really is good for everybody, and the fact that you can use it on all skin types, light, medium, dark skin tones, sensitive skin, everything is super helpful. So if you think you might be a good candidate for this treatment, let us know if you have any questions and we'll get you scheduled for a consultation. Thanks for watching.